Hi everyone, my name is Amelia Fleetwood and my final project is about socioeconomic status and mental health inequalities from quarantine isolation. So essentially I've been studying how mental health has impacted people from different socioeconomic statuses. Through secondary research, I found that many studies reported individuals with lower socioeconomic status experienced increased depression, stress, sleep quality, isolation, and fear due to the COVID-19 crisis. My interviews and ethnographic studies validated this finding, and many interview participants identified a lack of resources, so whether that be mental health counselors or access to health care for mental health, and they also stated that they felt more uncertain about their financial future more often than those I interviewed with higher incomes. So why is this important to us? I've identified two primary reasons why we should care about this issue and why we should do everything we can to help individuals impacted with mental health issues in 2021. The first reason why we should help to eliminate this problem is because there's a clear inequality amongst people of different socioeconomic statuses. I feel like identifying inequality should be enough to get people to care, but if it isn't, I can go more into depth. Inequality is not only unfair, but can lead to a jeopardized economy and lower rates of innovation. When we live in a world with complete social mobility, people are more likely to contribute to society, especially in regards to innovation. The second reason why we have to care is because of the long-term impacts that come from not addressing mental health. The CDC says that long-term impacts of untreated mental health result in increased stress, decreased social activity, and in the worst cases, suicide. I started my research study by conducting secondary research in this space. I found 3 studies that helped me to better understand the space and some problems that happen within it. First, I found a comparative study that examines the mental health differences between healthcare workers, higher income individuals, and lower income individuals. This study revealed that there is a significant increase in depression and anxiety among those with lower incomes. I used this study to better understand their research methods and to utilize them in my own project. I also found an article that describes a study conducted on hundreds of residents in a city in the UK. This study reported on mental health disparities within a number of factors from age to gender to socioeconomic status. I use this article to better understand how all factors contribute to one's mental health, not only their socioeconomic status. Lastly, I found a cohort study that goes into extreme depth about how the pandemic has impacted daily life worldwide. The aim of the study was to understand if the pandemic has had more psychological impact on individuals who are younger versus older. Next, the study researched whether these same findings could be applied to level of education and socioeconomic status. I used this study to really understand the impacts from the pandemic on individuals' mental health. Before I jump into the interview side of this project, I wanted to share a quote from a participant that I feel sums up the problem pretty well. One of my interview participants said, "It's scary having no job stability and no one to fall back on for help." That definitely did a number on my mindset during COVID. She mentioned how scary it was to not know if she would lose her job, and she said even the thought of losing her job caused her insane amounts of stress. Similar to the studies I researched, I divided my group of participants up based on the information they provided me. Rather than defining low socioeconomic status with the salary, I took the bottom 50% of incomes and education status and defined those as the low for my group. I then compared their income data to the definition of low socioeconomic status to ensure that these individuals fell into that group. Of course, all interview participants' data is kept confidential throughout my research. These interviews consisted of 4 individuals who each took part in 2 surveys. So with that, we can jump into my interview findings. One major finding I took away from my interviews was that there was a 100% increase in depression, anxiety, fear of COVID, etc. within the last year, so during COVID-19, in those with lower incomes. The largest finding, in my opinion, was that 100% of low-income individuals said their mental health increased tremendously after receiving a stimulus check. After further discussion, I found that this was not only because of the financial security net, but also because they felt that they had support from those around them. The last major finding from my interviews was that I found there was a 75% increase in loneliness, depression, and anxiety among people from all different socioeconomic statuses. This means that there are people suffering who aren't necessarily considered low socioeconomic status, and we should do everything we can to work on mental health as a whole, not just in the context of low socioeconomic status. To identify what we can do to resolve this huge issue in our society, I created a tiered system. The top tier is perhaps the most difficult to implement, while the bottom is the easiest to do. So in order to ensure those around us live happier and healthier lives, we must check on the people we love and even the ones we've just met. This study revealed that loneliness in this last year has skyrocketed amongst all levels of socioeconomic status, so we have to check on everyone in our lives. The second way to help would be to use your voice to advocate for people in these situations. As people, we must abolish inequalities in all forms, and the best way to start is to educate yourself and those around you. Lastly, our local policymakers have the power to actually change policies to provide health insurance, counseling services, and other mental health related services to those who need it. To make a difference, policies have to be changed.